YouTube channel. My name is Jamie Naftali. This channel is called The Pediatric World. It is a channel on kids' welfare, the medical problems, and we also try finding solutions. Here we educate the mothers, the caregivers, on the common illnesses affecting children while growing up. We talk in a language that everybody is able to understand. So I welcome you into today's episode. If you are new here, please feel at home. Be part of this wonderful family by subscribing. And if you're that returning subscriber, thank you so much for your support. So in today's episode, we are continuing with our topic on HIV in children. And today we are doing the pediatric HIV-related diseases. What diseases are related in a HIV-infected child? So the goal of today's episode is to describe the common diseases seen in HIV-infected children, their clinical presentation, how they present. We also want to know the management, which is the treatment of these the HIV-related diseases. Also, the common preventive therapies that we use. So this is the goal of today's topic. And in the introduction is that infections that complicate HIV diseases in children are: 1. Infections commonly seen even in HIV and infected children. So we are going to say that these infections are infections that are seen also in an infected child, the child who is not HIV infected. We also have opportunistic infections. These are rare in HIV negative children, so they are going to be more in HIV infected children. Why? We are saying that, remember we said what HIV virus does when it gets access to the body, it brings the immune system down. These children become immunocompromised. Their immunity is low, so then these opportunistic infections come in. So from the word opportunistic, they take the opportunity, they take the advantage of the low immunity into the bodies of these children. So these are now the opportunistic infections. They are more common in with advancing immune compromised children. So when the immune system is compromised, that is when we are saying they are rare in HIV negative, because the immunity is intact, unlike the immunity of HIV infected children. I hope this is clear. So HIV infected children also have other clinical presentations not commonly seen in other children. They have clinical presentations like things we call LIP. LIP is lymphoblastic interstitial pneumonias. So this is what we are calling the LIP. They also have skin conditions more oftenly. They also have malignancies. Malignancies are things like cancers. Remember, it's because the immune system is really so low. So common childhood infections seen in HIV-infected children. So which are these common childhood infections that are seen in HIV-infected children? Number 1, they have respiratory infections. These are the infections of the chest infections. They are the most common cause of the hospital admissions. So this is what makes these HIV infected children to get admitted more oftenly. The frequent visits to hospital and admissions, that is what we are saying. The cause is the respiratory infections. So some of the microorganisms that cause these respiratory infections include a microorganism we call streptococcal pneumonia. We have H. influenza and others. Those are just some of the microorganisms that cause these respiratory infections. These pathogens or these microorganisms are also common cause of bacteremia. Bacteremia is infections of the blood, also meningitis in HIV in children. Hope this is clear. So when it comes to treatment of these respiratory infections, the treatment is same as in HIV negative children, but the duration may need to be longer. What are we saying here? That these respiratory infections, these frequent chest infections, How we treat for the HIV infected children, the treatment is the same as that for the HIV negative children. The only difference may be that for the HIV infected children, these pneumonias are treated longer. The duration of treatment becomes longer. So how do we prevent these respiratory infections in HIV children, HIV infected children? We have, number one way of prevention is immunization. So we have something we call pneumococcal vaccine. It's via vaccination, and I refer you to my episode. There's an episode here about the immunizations in children. You're going to find this pneumococcal vaccine. It is one of the vaccine that was added. It never used to be there, but it was added recently because of these common respiratory infections we are talking about. So it prevents by doing the immunizations. We also give cotrimoxazole. Cotrimoxazole is Septrin. I think the easier way of saying it is Septrin. Septrin is a good one when we do it's a good drug to prevent these respiratory infections in HIV infected children. So we use Septrin more oftenly. So how about infections causing diarrhea in HIV infected children? That was respiratory infections in HIV infected children. How about the infections causing diarrhea in HIV infected children? So they are oftenly, they get acute, persistent, and also chronic diarrhea. These children get acute, chronic, and also persistent. The diarrhea is always there. It goes on and on. So this is what we are meaning by persistent. So the important cause of the morbidity in children with HIV includes microorganisms. So the microorganisms that commonly cause diarrhea in these HIV infected children, we have things like rotavirus. Yes, rotavirus is a common cause of diarrhea in children. So rotavirus, we also have E. coli, we have bacteria like salmonella, we also have a bacteria called the candida. So candida is also a cause of diarrhea in children infected with HIV. So mostly I may emphasize more on the rotavirus. It's the commonly cause of these diarrhea. And again, back to the immunization, we are currently giving rotavirus to prevent these diarrhea in children. So this is it. And also we have those microorganisms again causing opportunistic pathogens, those causing the opportunistic pathogen, and this is specifically to the HIV infected children. We have a common virus called the CMV, the cytomegalovirus. That is the CMV. We also have the herpes simplex virus, the HSV. So another one is called Cryptosporidium. I know it's a bit hard and difficult, but just at least you know the SMV, the cytomegalovirus. You also know the herpes simplex virus. So these are the opportunistic pathogen, the microorganism, the pathogenic that cause the opportunistic infections in these HIV infected children. So I hope you understand. Now we have started on the infections, the childhood infections seen in HIV. We have seen the respiratory infections and also the diarrhea diseases in HIV infected children. So I hope this is clear. We are going bit by bit so that people can understand this. So this is the end of today's episode. So keep tuned for more. Also, if you haven't subscribed, please consider subscribing. Hit that red button, subscribe, so that you may be part of this family. Also, turn on your notifications so that you are among the first people to know every time I post a new video here. So, till next time, bye-bye.